Hey guys, this is going to be fast and furious. 5 components of subluxation. It's kind of 4.5. We'll call it 5. First one is restricted motion. That means you can't turn your head to check your blind spot. You see these people doing this. Here's how they turn their head. Their whole body turns so they can see behind them. You can't bend over to tie up your shoe. You got to jack your shoe up on a bench or on a chair to be able to tie up your shoe. Second one is muscle tension. What your body does is tighten muscles around an area that's irritated or inflamed. Healthy response in the short term, it's a great acute response. Chronically, it causes degeneration and damage and accelerated breakdown of your spine. Third one's this, onset of inflammation. Inflammation is healthy in the short term. It's the first biochemical process that happens in the healing process. And so, you twist your ankle, it swells up a whole bunch. It's actually good. Your body's healing, that's what it shows. Now what the problem is that we put things on it, we put ice on it, we compress it, we lift it, all those things. And so that's done for people like athletes or like you have to go back to work, that sort of thing. But actually allowing it to recover and be swollen some allows the healing process to happen better in the short term. Now chronically, same thing, causes a lot more degeneration to happen because the inflammation damages the joints. Nerve pressure. The old concept was this. There's a hard bone at the bottom, there's a hard bone on top, there's nerves in between. When one gets out of place, out of position, what happens to the nerves? They get squished. And so about 10% of the time that is what happens, but the majority of the time it's actually these other components, restricted motion, muscle tension, inflammation, that actually irritate nerves, decrease their ability to communicate from one end to the other, and sometimes cause symptoms or pain, sciatica, tingling in the arm, those sorts of things. Here's what it used to look like. Hopefully you can see this, just like this. That's the idea of bones pressing on nerve. And again, that does happen sometimes, but most of the time it's the other components that actually cause that nerve function to be lost. Harmful effects. Now this one is really a combination of all the other 4. In the short term, these things are fine when there's an injury or an acute sort of situation, but chronically, they cause the spine to degenerate 2 to 3 times faster than normal. That's why we check babies, we check newborns, we check kids. 85% of kids are subluxated from the birth process. If we can fix it then, it does not become a problem down the road. We want to proactively keep spines healthy, get people well in the first place, but then keep them well. And you get to do that for as long as you want. I think you should do that for as long as you have a spine, but you get to choose.